That way anybody that wants a copy of it can get a copy of it. And I just want everybody, real quick, I just wanted to thank Holly Andrews so much for being in the backdrop all the time, making sure that our notes are taken care of, and she takes really great minutes and sends them out every day, that we have these communications. So I just wanted to thank Holly for her hard work, and make sure that you get into the chat box if you have any questions, because Holly will be looking through that look at links, and to make sure that you can go through that and get the communications out. So get into the chat box if you can. I want to thank everybody for coming in this morning for usually this is our monthly update. This update is usually put on schedule about a year in advance, and so what's really awesome about it, we already had some things on schedule for our safety topics that really directly hit what we're dealing with right now. So we're lucky that we already had kind of a schedule together. And today we've got a great speaker and industry expert when it comes to safety and code enforcement, John, and he'll jump into John with Osha, and he'll jump into Q&A a little bit of what they're dealing with out there in Osha, as well as having to deal with so many different types of inquiries and complaints and documentation that we need to make sure that we have out there as safety professionals, and really right now business owners and professionals, that we're paying attention to just so many different things coming at us. So we'll have John jump in on that. I did want to thank Holly again. Right now I have everybody muted. If you could keep yourself muted while we're doing the session, I'm going to mute myself once John gets started, but get into that chat box. Make sure you ask some questions, and we're going to send those out once again. And we just wanted to start off really quick before we jump into the conversation. Does anybody have any questions that you want to pop in right now about today's session? Maybe that we can be proactive here on the background to take a look at those questions and get them shared out to everybody. So if you have any quick immediate questions, jump into the chat, and we'll go ahead and start taking a look at an outline for today's session on making sure your questions are answered. So good morning, my name is Paul Lingo with IEC Rocky Mountain, and welcome to our meeting. Having said that, jump into that chat, and I'm going to pass it on over to my man John.
Okay, thank you, Paul. I am going to bring up a presentation here, and so I don't think that I'm going to be able to see the chat. So if you are able to watch it, if you see questions come up, I think when I actually share my screen, I won't maybe be able to see the chat. So if you see questions come up, go ahead and feed them to me. And if anybody wants to get off mic real quick, or put their mic on real quick and just jump in with one, that's fine by me as well. All right, give me just 1 second to get this up.
I can see you, so just so you know.
Okay, can you see the slideshow?
Yep.
Okay. All right, so good morning, everyone. My name is John Eliachea. I am the Compliance Assistance Specialist for Region 8 of Osha. And we're going to give you a couple of topics today. We're going to talk about temporary workers, and we're going to talk about COVID-19. So we're going to spend a little bit of time on each. Paul, did you say I have, how long do I have? About an hour-ish?
Oh, we've got it booked until 9 o'clock. And so if we run over, I want to make sure that we gave us plenty of time to get through some questions, as we will have kind of a larger audience today, which would be nice. It looks like currently we've got close to 30 in, so we're doing really good. So is that enough time for you, or do you think that's too long a time?
No, I think that'll be fine. Just, if we're getting close to the end and you want to make sure I cover anything, just kind of, or maybe give me a 10-minute warning when we're coming up close to 9 o'clock. Sometimes I kind of lose track of the time. So I would say that probably the most important thing you can get out of this presentation, if you haven't already gotten this, is my contact information. because you may have questions later about some of these topics, and you can certainly get a hold of me. There's my email and my phone number. Email is probably the best way to get a hold of me, but the phone works as well. I am, as I said, the compliance assistant specialist. So what I do is I do outreach. I do outreach for Region 8. I am a non-enforcement type, but one of the few. I was a compliance officer for many years, but I transitioned into this about 5 years ago. And so now all I do is try and get information out to employers, unions, trade associations, the general public, whoever needs it. So please make sure that you have my contact information and get in touch with me if you have any needs at any point. As we go through, like I said, please, you can hop on the mic and ask a question or send a chat and maybe Paul can read it to me. I would be very happy to answer any questions or at least attempt to answer any questions as we go through. So we're going to talk first about temporary workers. And this is, kind of a big issue. It's a major focus for OSHA over the last few years. And the reason for that is we see an increase in staffing agencies and the number of people that come from staffing agencies that are being employed. Now, I don't know how the numbers really have been affected in the last few months because of the COVID pandemic, but generally speaking, we have seen a rise in those workers. And unfortunately, they are disproportionately injured and become injured or ill at a rate higher than normal workers. Now, it seems like probably, there's a few causes for that. Number one, they're very often not familiar with the work environments that they're going into, familiar with the tasks that they may have to perform. And then in some cases, you have host employers that maybe don't provide the same level of training or protection to those employees when they receive them. They may feel that, hey, I've got this employee for a week, and I'm paying them for a week. I need a week's worth of work. I don't have time to train them or certify them on how to use a forklift. I just need them to move all those pallets from one side of the warehouse to the other. And because of that reason, a lot of times we do see that these workers get injured because they're unfamiliar with the work environment, they're unfamiliar with the job duties they have, they're unfamiliar with how to protect themselves. And so that is a major issue, and it's something that OSHA has been focusing on. Some of the things that we've been doing is when we do a inspection now with that involves temporary workers, we put a little bit of extra information into our database and make sure that we make contact with the staffing agency and let them know that we've conducted an inspection, and especially if there's any kind of accident or it's some sort of complaint or accident or fatality, we're definitely going to be in contact with the staffing agency, and we're going to look at both employers, what their responsibilities were through that. Now, it's important to know that both employers have responsibilities, both the host employer and the staffing agency. Now, I will be, honest with you up front here. Most of the time, we're going to be looking especially at the host employer when there are accidents or potential exposures to hazards from those employees, because the host employer, their site, it's generally their hazard that's been created by their business, and in most cases they're providing that day-to-day supervision of that employee. So essentially, in our eyes, they're the employee of the host employer, though they're getting paid by and having certain other things taken care of by the staffing agency. Oftentimes the staffing agency doesn't have direct supervision on the site, and they're unfamiliar with the or somewhat unfamiliar at least with what's going on the site, and they certainly can't, they're not in control of the site. And in construction you have constantly changing environment. There wasn't a trench there yesterday and now there's one today, or the scaffold looked great yesterday, but today somebody came over and stole all the railings to to put another scaffold somewhere else. So those kinds of things are something that the host employer is probably going to be more aware of than the staffing agency. But both employers do have some responsibilities, and we're going to kind of talk about some of that. On our website, you'll find a number of bulletins that have been published by OSHA regarding temporary workers and how to protect them in the work environment. They have individual ones that talk about hearing conservation, hazard communication, I think forklifts, things like that. But in that list, and I'll show you that website here in just a bit, in that list, you're going to find the first bulletin or document that we have kind of on the, I think it's on the right side of the page. It is just a general guidance. And it lists a number of things. I've put a few of them up here that it recommends for protecting temporary workers. Now, keep in mind, this is not necessarily what we're saying we're going to base citations on, but this is just generally how you should protect those temporary workers. And the first one is evaluate that host employer's worksite. Now, some temp agencies are going to be really large and they're going to have a lot of temps all over the place. They may not be able to do this, you know, on a daily basis, but they certainly, you know, when they're taking on a new contract or one that's going to be around for a long time, that's something that they should be doing, is evaluating that host employer's worksite to see if there are hazards out there and what kind of training the employee should be receiving. Additionally, you know, they should be training some of their staff to recognize hazards, to, you know, do that evaluation. If you just send out someone who isn't familiar with safety and health, they may not be doing the best evaluation that they could be doing, or that the company should be doing. And then you want to ensure for each other that the other employer meets, or each employer meets the other's standards. So, you know, for both the staffing agency and the host employer, you don't want to take on, you know, a relationship with another company that has maybe a horrible record for injuries and illnesses, or they don't have any kind of safety and health programs, or they don't have any training for the employees. That's something that, you know, could be a potential risk for both sides. You know, if you're sending your staff, your staffing agency, and you're sending employees out to a construction site, then if there's a lot of problems on that site, you could be exposing your employees to that kind of to those hazards and to higher risk than they should be exposed to. And vice versa, you know, there may be some staffing agencies that just don't do what they need to be doing, and as a host employer, maybe you should look somewhere else. Assigning responsibilities for safety and health within the contract. Now, this is something that I think works for the two employers involved in terms of kind of figuring out who's responsible for, you know, what training, what kind of, you know, if issuing PPE is something that the host employer thinks that the staffing agency is going to do, that should maybe be in the contract, so that, you know, you kind of have a guideline for who's responsible for what. Now, OSHA, like, let's say there's an accident or there's citations, we're not necessarily going to be tied to what's in the contract language. That's something that will help the two employers to better protect those employees. But we've seen contracts where, say, you have the host employer and the contract says that the staffing agency will provide all the PPE that's necessary. Say it's a hard hat and safety glasses and steel toe shoes or whatever. And then we issue a citation because there are employees on the host employer site that are working without those things and they are needed. And the host employer wants to say, well, it's the responsibility of the staffing agency. true, in the contract, they were supposed to do that. And we would probably, in that case, look to potentially cite the staffing agency as well. But as the host employer, if that staffing agency employee shows up on your site without the proper equipment, whether it was in the contract or not, and you allow them, you know, right in front of the management, you allow them to continue to work without the protection that they need, you know, you're just as liable for getting a citation because you're allowing those employees to work without the proper protection. Conducting safety and health training, project orientation. So that's something that can also be written into a contract. There are cases where sometimes when a staffing agency is sending a lot of employees over a long period of time, the host employer will send along training materials that they expect the staffing agency to go through or provide to employees before they show up on the site. An example of that, I did an inspection when I was still a compliance officer. It was for a waste hauler, and they had a contract with a staffing agency where it said, before any employees are sent out to our site, they have to get this orientation video, and there were like, I think there were like 3 videos they had to do. They had to have certain PPE with them. So some of that stuff was already taken care of so that employees showing up on the site already had an idea of what was going to go on. And I had done an inspection where there was a pretty bad accident, and the staffing agency had not provided that employee with any of the training that was required. But the host employer had not asked, had not really given that employee any training, had not checked it all, just sent them out. And so both companies were cited in that case. There were a few other issues going on as well in terms of practices, and even some stuff on the truck itself that was outside of ANSI standards. But you know, they had put it all kind of on the staffing agency, yet the staffing agency wasn't doing it, and no one was checking to see. No one was even asking the person, you know, hey, did you get your training from the staffing agency? Have you seen our orientation videos? Have you seen this video on how to ride on the back of the truck? You know, another good example of a staffing agency and host employer relationship, I did an inspection back years ago on asbestos. And in the asbestos abatement industry, you have companies that the asbestos abatement companies, they go and they rip out the asbestos before there's a demolition or renovation on an existing building. And depending on what type of asbestos and what the exposure level is from the monitoring they do, there's different ways of, or different kind of engineering controls and different respiratory protection that's required. Well, this particular job was one that had a high level of exposure to asbestos, and they had their containment, and the employees of the host employer were inside the containment with supplied air respirators because the asbestos level was very, very high. And in the asbestos abatement industry, there are a number of staffing agencies that just concentrate on asbestos abatement, because I think that industry, you know, you may need 3 workers one day and 15 next week, and it just kind of goes up and down. So I had gone out there. The host employer's permanent employees were in the containment with supplied air full face respirators. The staffing agency employees had shown up with just half-face respirators, and they went into the containment with those. And so I had asked the host employer, why the difference? Why aren't these guys protected? And they said, well, that's what they were sent in, so that's what we sent them into containment in. And you just can't do that as a host employer. They knew what the level of asbestos was. They knew what the type of respiratory protection that was required was, and they let those workers go in without it. Let's see, next, overall safety program. You know, you just want to make sure that employers have a good safety program on both sides. Incident, injury, and illness investigation. We recommend, this is a recommendation, that if there is an incident, both employers go ahead and conduct an investigation. That will help them to ensure that that does not occur in the future with other workers. And then record keeping. This one's pretty simple for the most part. With the record keeping, you just want to make sure that, first off, it is only recorded once. So each company is going to have to keep a OSHA 300 log, most likely. But one injury can only be put on one log, because these logs, we're trying to figure out what are the most hazardous work environments. And so if you put one injury on two logs, you know, we don't want to do any double counting. We just want it to be attributed to one location. And again, we are trying to determine what is, you know, where are the hazards. And so generally, you're going to put that injury, record it on the log of the location where it occurred and the company that provided the day-to-day supervision. So, you know, it generally, I would say 99% of the time, it's going to go on that host employer's log if it occurred at the host employer's site, because it's their, you know, it's their hazard that has been created because of their job site, their job process, whatever it may be. So it doesn't make sense to attribute that injury or illness to the manpower office, because that's not where the hazard is. All right, our website has quite a bit of fairly new information. A couple years back, we started issuing these bulletins on protecting temporary workers. You can see them there on the side of the website. There's, you know, kind of just a general one, and then there's ones that talk about PPE. There's one that talks about injury and illness record keeping. So it kind of runs you through some of the scenarios. Our record keeping site also has a good question and answer section where you can kind of put in keywords and get a lot of good questions or answers back about, you know, specific scenarios. But if you ever had any questions, you could, you know, feel free to give me a call and we can kind of run through it. But there's, I think, maybe 11 or 12 bulletins there. You can see the website is on the side there. If you get this presentation from me, if you send me an email, I can send you a PDF of this. You know, that link will work. Then these are just a couple of the worker bulletins that are available on our website. Recommended practices, that's kind of some of the things that I was talking about before. There's, you know, that's obviously going to be a little bit more detail there. And it's really about how to protect the workers. And then you have other stuff like noise exposure and hearing conservation available on the website. So I think that's kind of all I had on temporary workers. But are there, you know, I'd like to pause here and see if there are any questions on that before into COVID.
I'm not seeing anything in the dialogue or the chat box right now, John. Did want to ask a question. I wanted you to get through your session there, but I wanted to talk about, in the outline you talked about a safety program within the company. I know that a safety program within some contractors' companies, that could vary as far as what that looks like. You've got some smaller contractors that wear multiple hats, right? And then you've got whole, like bigger companies that have a whole safety department, right? So maybe the best practices of a safety program, maybe you could go into a little bit of that.
Sure. You know, there's a lot of variation on the safety programs that we see out there. I think one of the best things that you can do as an employer is we do have a safety and health management guidance document on our website that kind of runs you through kind of all the things that you could and maybe should consider putting into your safety and health program. But first off, you want to make sure that you have all the required stuff, anything required by the OSHA standards. But then beyond that, I think you want to make sure that you have a program that's, constantly being updated and evaluated to, determine, hey, are we addressing the hazards that we are seeing on the job site, whether they be things that are required by OSHA or not. A good system of having investigations of incidents, not just recording things, but, I think that and again, this is not necessarily required by OSHA, but incidents should be investigated, even near misses. Some of your VPP companies and some of the best practices out there, they investigate not just every incident, but all the near misses and encourage the reporting of near misses. That's something that I think a lot of employers fail to do, or fail to maybe create an environment where employees feel safe in coming forward and saying, hey, I almost got hurt the other day because of this, because they're afraid that they're going to be punished or something like that is going to happen to them. But
it's kind of like, I feel like it's tattling in a way, it's that they don't want to get anybody else in trouble for something that didn't happen. You know what I mean? It's a hard mentality to break out there, because near misses. That's a great conversation that you just mentioned. That we talk about that here in our safety meetings a lot. Is what are our near misses? What are some things we recognized? And I think that, and I say this all the time about safety, and that is we only really pay attention to it when something bad happens. You know what I mean? And
right.
And that's because of the fear of. Go ahead.
I was just going to say that, that is really, kind of a best practice in itself, is being proactive.
Yes.
Addressing things before they happen, not just reactive all the time.
And incentivize
safety.
Yeah, incentivize it. It's we recognize our workforce for doing these great things, but how about recognizing a team of individuals that don't have any, safety issues, or been able to put in, the JSAs and work reports and the administrative controls, and making sure your engineering controls are up to date. But incentivize that kind of stuff. Call it out when you notice a safety practice, and let people know that, hey, it's okay to be safe. It's okay to say something, or get somebody's attention on a situation that if you don't look at it as a near miss, it's an accident waiting to happen.
Yeah, absolutely.
Absolutely. Well, thank you, John. I know that. Thank you for the information. For the information on the record keeping and kind of the transferring, make sure the documentation is good on the staffing agency side or the borrower. I do now want to just talk to you a little bit, or have you talk to the group about how OSHA's doing with this new situation and new norms that we're dealing with. Is there anything that rings out as far as new OSHA processes on what we're reading about when you go on site, and some of those safety measures as far as the pandemic aren't being able to. What are some things we need to know as contractors and business owners to make sure we're in guidance of the current situation?
Sure. You're talking about COVID now, right?
I am. Yeah. Let's jump into that.
Yeah, absolutely. So we'll talk about that the rest of the time. And if anybody does have questions about temp workers, please go ahead and ask those still. But Yeah, we will talk about COVID now and what's going on. And it is, an unprecedented time. It's kind of an ever evolving situation. Um, but we'll talk about how OSHA's addressing it, what OSHA's role is kind of right now, some of the enforcement guidance documents that we've put out there. We've been cranking out a lot of stuff to just kind of let industry know what we expect of them, how we're handling things right now. And so we'll go through all of that. First up, though, I would say, I'm no expert on COVID itself. I mean, I don't even know that there are a ton of experts out there. As you've seen over the last couple of months, the information that comes out kind of changes a little bit from time to time as we still try and kind of figure out how exactly this thing is spread and how it's controlled and all that. So I'm not by any means any kind of expert on COVID itself. What I'm going to be talking to you about today is just kind of what OSHA expects of employers and how we're handling it. We're going to dispense with, these slides come from a longer presentation that has a lot of information on, just kind of generally what has gone on with the pandemic, where COVID came from, the symptoms and signs of infection, things like that. We're going to dispense with that because I think that that's something that most people know already, and just kind of get into how OSHA's dealing with it. So, there are certainly a lot of businesses that could have, risks of exposure. And now that a lot of the states, including Colorado, are kind of going back to work, though it is slowly and in a different form, there's going to be more potential for exposure. And so we're going to talk about first kind of, how we break that out. And you can see here are some of the sectors or industries where we would expect to see potentially high rates of or high potential for exposure. Healthcare and laboratories, obviously, emergency response, those top three are some mortuary and death care. The people who take care of the bodies after they've died. Those are some really big ones. Airlines could be as well. The airlines have kind of been shut down there or not shut down, but significantly decreased and, parking most of their fleet in Arizona. But once it gets bustling again, they certainly are going to have potential exposure, border protection, and then retail operations. Those people are right on the front lines as well, and they have to be out there dealing with the public and a lot of fairly close contact. Food processing, you've all, I'm sure, in the news heard about the meatpacking industry and how there are just massive outbreaks there. One of the things that the main reason in those plants is because they virtually work on top of each other. I mean, they are shoulder to shoulder, and it is very crowded in there. And, we're trying to get them to kind of implement measures to back off on that and put partitions and do various things. But that is an industry that has been highly affected because you get a couple people in there and it spreads like wildfire. Then some of the others that could be at risk for some exposure are manufacturing, construction, if you have a lot of people working closely together, oil and gas, some other sectors. So as we go through this, there are a number of documents that have been released by OSHA, and they talk in some of them about exposure risk categories. And so I want to run through those real quick. First category is very high, and that's going to be your healthcare workers and lab personnel, and then morgue workers and people on COVID patients at the time of their death or after their death. And so they're the ones who are really going to be at the highest levels of exposure, because they're the ones who are dealing with not just the potential of COVID, but a lot of the patients they see are confirmed to have COVID. Some of the procedures that they induce create aerosol that would spread COVID. So now I know that, obviously most of the group in here are not going to be in this category. Then there's a high exposure risk as opposed to very high. This is, other healthcare who maybe aren't doing the kinds of activities that create those aerosols, but still have to be around suspected or confirmed COVID patients, medical transport workers, and again, some of the people dealing with the Now, we have medium exposure risk, and that would be some of the other jobs where there's going to be either close contact with the public or lots of coworkers, or there's going to be continuous and frequent contact. And this could involve many, many different industries. Certainly, grocery stores and pharmacies, the transportation industry. It could include construction if you have, a workforce that's working very closely together. And certainly, if you were to get some confirmed cases, then, your risk level is going to go up a lot higher. And of course, in this would also be the meatpacking plants, which really would be high risk once they have, a couple cases. They're, like I said, it's going to spread quite quickly at least the way they used to operate.
What about
And low risk jobs? A school, yeah. Oh, of course. Yeah. A school would be a place, anywhere that you're going to have, continuous or close contact. Yeah. Now, we didn't put them on there. Lots of places could be on there, but right now, most of the schools are out. Who knows if they're going to go back in the fall? That's, you hear different things, but school definitely would be a place where they're breeding grounds already for, all kinds of things. Most children are pretty much sick off and on all school year. But yeah, definitely a school.
That we
I'm sorry.
consider medium risk.
I'm sorry, what did you say?
I'm trying to turn my volume down.
I didn't quite hear you.
How's my echo now? Still there?
Yeah, I can hear you.
Okay. Would you say then probably a school by default would be considered medium risk?
The school, man, if you're talking about a school that doesn't have confirmed cases, then maybe you're starting at medium risk. But if you get a few cases in there, it's not maybe. It could easily go up to a high risk. And then, so exposure risk low would be those jobs where you don't really have to be around the public. You don't have to have close contact with your coworkers, or at least there's a way to get around that. Maybe you got a big warehouse and there's 4 people in it, and they're not going to be. There's no real need for them to get close to each other to touch the same things. So that could, in some cases, that could be a certain construction sites where, you don't have a big crew and they're maybe working somewhat individually or able to easily maintain a distance of 6 feet. So what we, kind of want employers to do just generally going forward is assess your exposure risk, and then you're going to make determinations on how you handle that exposure or how you minimize those risks based on the kind of exposure that you have. Is it low? Is it high? What do you need to do based on your own assessment? Kind of like a job hazard assessment. You're going to conduct that and figure out what you need to do, what are our risks, how can we control those. Now, as far as OSHA enforcement goes through this, during these kinds of situations whether it be like, pandemic or Katrina or 9/11, we try to take more of a technical assistance role. We're just trying to help employers to ensure that workers are protected. I know that, you know, in some of those other incidents that I mentioned, like Katrina and 9/11, they sent a lot of OSHA employees out there to help with the passing out of respiratory protection and doing fit testing and doing, you know, training on PPE, that kind of thing. Now, this is something where we're, you know, this is nationwide, so we're really kind of not doing that sort of thing, but we're trying to provide as much technical assistance as we can. We've issued a lot of documents, which we'll be going through some of those, but we've, beyond the ones that I'm going to talk about with enforcement, we've also got tons of guidance documents. There's one specifically for construction, kind of outlining what we expect employers to look at and consider and follow during the pandemic as they have employees returning to work or as they've worked throughout the pandemic. So we really try to keep it, you know, technical assistance and you know, outreach. But as you can see in the blue box on the side, we still, you know, all the standards are still in effect. We still have to enforce those and have the ability to enforce those when we need to. I mean, obviously, we always need to enforce the OSHA standards, but you know, we are not doing enforcement at this time, but we are, especially with regard to COVID issues, trying to come at it from a technical assistance posture. Some of the standards that are already in place that may be of benefit during the pandemic would be, as you see, the ones that are in the blue box on the side, obviously PPE big during this. And it's an issue where, at least early on, there wasn't enough PPE. And a lot of the guidance documents that I'm going to talk about are about the lack of PPE, especially respiratory protection. So you have, and that one shows general industry, but we have essentially the same types of PPE standards in the construction industry. Bloodborne pathogens, it doesn't really apply to COVID. However, in the healthcare industry, you can kind of use the bloodborne pathogen program as somewhat of a model to follow to put together a program to deal with the spread of COVID. Hazard communication, obviously there's going to be use of new chemicals that maybe work sites have not used in the past to disinfect surfaces and things like that. So that's something that you'll want to add to your hazard communication training and make sure you have SDSs. And then record keeping. I'm not going to talk about that right now, but we are going to talk about that in some detail here in a little bit as far as how we're expecting employers to do the record keeping on COVID. And then there's the general duty clause. So the general duty clause basically says that employers are expected to provide employees with a work environment that is free from recognized safety and health
Did we lose John? We lost John? Huh. Well, I'm sure he'll be back with us in a moment. I'll reach out to him.
Yeah, just when it was getting good.
Oh, yeah, just when it was getting good. Yeah. Let's see if he pops back on. Good morning, Steve. How are you?
Pretty fabulous. How about you?
I'm doing well. I'm doing well. I'm going to see if I can get back a hold of John here. Shouldn't take but a second. Are you guys getting an echo now off of my voice? Okay, so I think it's had something to do with John and his connection maybe that was causing the echo. We'll see if we can get it back on.
Yeah, there's about 32 of us on here, Paul. I'm not surprised that it gets a little distorted.
Yeah. Especially if someone's not muted. I'm trying to reach out to John here right now.
Can you hear me, Paul?
I can hear you.
Okay.
Oh, John, there you are. It looks like we lost the echo too. Nope,
Okay.
not anymore.
I got muted at some point, and I don't know when that was.
Oh, yeah, but it looks over here like you got dropped off. It dropped off.
Oh, no, it looked like it was like somehow I just got muted. So I was talking, and I don't know when, where I was.
You've been out for about 2 minutes.
Okay.
You
Yeah,
had just
and
started on the general duty clause.
Okay. Okay, great.
Thanks, Steve. Thanks, John.
Yep. Okay, so yeah, as I was saying, and I don't know how much was heard, the general duty clause is there. It's something that we are able to use to require employers to conduct an assessment, and if there are recognized hazards within that industry, and there are feasible means of reducing those hazards, minimizing the exposure to those hazards, we do expect employers to do that. So CDC has put out documents and guidance. OSHA has put it out. There are other things out there. We do expect employers to take action when necessary. Now, how do we define that? It's going to be kind of a case-by-case thing. But I would say, and we might have time to get to it in, towards the end, I can bring it up, but there's, for instance, a construction guidance document that's out there that OSHA put out. Now, it's not incredibly detailed, but it lists 10 or 15 things that construction employers should be considering doing during this time. And especially if you've got employees, a lot of employees working closely, or you've got a documented case or suspected case, you really want to be looking at that, because if we get let's say we get a complaint, we come out and we do an inspection, we're going to be looking at, okay, what was the risk to the employees, and what has the employer done to minimize that risk? Now, again, there's nothing concrete. And we haven't, I don't know how many of these general duty clause citations have been issued across the country yet, if any, but it is something that we will be looking at. I do believe that some of the state programs have actually issued a few. So I want to talk about enforcement and some of the guidance documents that you'll see out there. We have quite a few that we've been issuing. A lot of them have to do with respiratory protection. So there's a list of them up there, and I think there's actually even a few more that we're going to talk about beyond what's in the blue box there. But the first one that came out was on healthcare, respiratory protection, annual fit testing. We put that out, and then a few weeks later, we also added it, kind of a second document that built upon that one that was for all industries. And what this thing says is, I mean, right off the bat, it was clear that America wasn't quite ready in terms of their supply of PPE. And we recognized that there was a problem with not enough respiratory protection, certainly not the N95s that were being used in a lot of workplaces, especially within the healthcare industry. So what we said is, in that first document, we were talking about recommending the conservation of respirators while still protecting those healthcare providers. And as I said, this later expanded to all industries. In all of these documents, one of the things that is said in each one is, going back to the hierarchy of controls and making sure that employers first look at, hey, can we eliminate this exposure, or can we engineer it out through ventilation or isolation or things like that? Can we do work practices? So respiratory protection is always going to be kind of at the bottom of the totem pole in terms of, ways to minimize exposure. But we do realize that it's going to be necessary in some cases. Sometimes you just can't engineer it out. And, that's probably especially true in the case of COVID, especially in the healthcare industry. So what we said was, we're recommending conservation of respirators. CDC has put out some guidance on that. Also, so along with that, we're saying maybe look at using higher levels of protection. Instead of just an N95, maybe go to N99, N100, which I think those supplies were quickly depleted as well. But even going to higher levels of protection, like a elastomeric respirator with the filters that you screw on. Also, going to qualitative fit testing when you're talking about an N95. So an N95 filtering facepiece, if it is required to protect an employee, then you have to fit test it. And if you use quantitative fit testing method on an N95 filtering facepiece, it will destroy that respirator. So what we allowed for some employers to do is, if you're showing good faith efforts to try to conserve respirators, then we said you can go past the date for your annual fit testing. As long as you have that initial fit test, we don't want to see respirators destroyed for fit testing annually. So we allowed, in some cases, employers to go beyond the deadline for annual fit testing. A lot of employers think that fit testing is not required. That is not what the document says. It says you do have to have an initial fit test, but we are going to use discretion if employers are showing good faith efforts to protect employees and conserve respirators. We're going to use discretion in not enforcing the annual fit testing during this outbreak. And for all these documents that I'm talking about today, pretty much all of them say something along the lines of, this is a temporary policy during the pandemic. It's no longer going to apply upon notification. So when, this is over, these things will be rescinded kind of without warning. But again, it's talking about good faith efforts. It kind of says that throughout all these. So, yeah, you can go past the fit testing date, but you can't go past the fit testing date if, I can go down to Home Depot and buy a crate of N95s, because now the conditions have changed. So part of it is you want to be monitoring the supply that's available. So if, there comes a time when there are plenty of respirators available, we expect people to get back to it, even if this document's still in place. So like I said, it also added a little bit later the same kind of, it was a kind of a second document that included all industries, because we realized that not only is healthcare out of respirators, but now people who need to protect their employees from silica, and say they were using table 1 in the silica standard and had to use a filtering facepiece, N95 respirator for 4 hours a day or whatever when they're doing the task. Now they're out of those. So we recognize that, and so these documents started affecting all industries, not just healthcare. The next thing that we put out was the supply shortage on disposable N95 Ffrs, filtering facepiece respirators, and this allowed, again, enforcement discretion, provided there's good faith efforts on the employer's part, but enforcement discretion when employers decided to allow for extended use of respirators or reuse of respirators beyond when they normally would. So, you know, taking that N95 and instead of throwing it away at the end of the shift, maybe using it for more than a shift, more than a couple shifts. But the thing is, you have to make sure as an employer that that respirator is maintaining its integrity, so it's still functioning properly. The employees are performing a seal check, and that if you're going to do that, you have to address that extended use or reuse in your written respiratory protection program. You should put that in there. Okay, now we're, you know, because those programs, all your written programs, as we were talking about earlier, you want to be proactive. All your written programs should be updated as they change. So if you have a change in policy and you're saying, okay, now we're going to have to use N95s for 3 days before we get rid of them, you want to put that in there. And one of the things that you want to put in there is the fact that, well, kind of an explanation of when, under what circumstances that respirator is no longer usable. When is it, you know, maybe even considered dangerous because it's not functioning properly. But we have allowed for some discretion on our part when employers decide to extend the use or reuse those respirators, because we do recognize that an N95 probably on the second or third day is better than a surgical mask or a cloth covering. And then secondly, we allowed for use beyond the manufacturer's shelf life. So CDC and NIOSH got together. Well, NIOSH is within CDC. NIOSH looked at a number of different models of respirators and kind of did a sampling of those respirators to determine which ones would still be effective even beyond their expiration date. And they put a list of those on the CDC's website. And we are allowing for those to be used even though they say they may be expired. So, and this, again, it applies not just to healthcare, but to all industries, and for, you know, the use of respirators that would be important for protecting employees against other contaminants beyond COVID, you know, silica, lead, those kinds of things. And again, with all these documents, we're talking about looking at good faith efforts and allowing for enforcement discretion. But we are looking, when we're talking about good faith efforts, we're, you know, trying to figure out, has the employer looked at other feasible controls, you know, separation, partitions, in the case of healthcare, cohorting patients, and then monitoring that supply, prioritizing the use of those N95s for maybe the people who really need them, you know, really conducting an assessment. If you've got 100 N95s and you think they're going to have to last you for the next 2 months, and you got 50 workers and a lot of them are using them voluntarily for certain things, you want to maybe look at, you know, those guys going to a lower level of protection and saving those for the guys who actually have to be protected from silica or whatever it may be. One of the next ones that we put out was the respiratory protection certified under standards of other countries. You know, we ran out of respirators very quickly here. Respirators under OSHA would be those respirators that are NIOSH certified. So they're going to have the NIOSH stamp right on them. However, we realized that we were running out of those. And so OSHA put out some documents, one in particular that talked about respirators certified under the standards of other countries. And we put a hierarchy as far as when and how to use them. So the first choice is always going to be a NIOSH certified respirator. That's what you need to use if those are available. Second would be a respirator certified by another country except for China. And there's, I think there's about 8 or 10 countries listed. Australia's in there, Japan, South Korea, Europe, couple others, Brazil's in there. So if you're listed on that document, you can use one of those countries' respirators, provided it was certified by that country. So any of those except for China, those are kind of the second tier. And then if those aren't available, then you can use a respirator certified by China. And then lastly, you would go to face masks, face shields, facial coverings, things like that, which aren't really respirators, but that's kind of how we expect employers to, the hierarchy of what to use first to last. And then it also said in that document that for healthcare, you cannot use a Chinese certified respirator unless it's kind of a last resort. And for surgical procedures, for those procedures that would generate aerosols, you can't use that unless it's a last resort. But again, that's for healthcare. It doesn't affect the construction industry. And then we put out a document on decontamination of filtering Facepiece respirators. And that one talked about, the fact that the OSHA standards do not allow for decontamination of disposable respirators, those filtering Facepiece respirators, because if you decontaminate them, they actually lose their NIOSH certification. They are no longer going to be certified by NIOSH. However, again, we realize in this time, a decontaminated respirator that may be slightly affected is probably still better than a handkerchief or something around your face. So NIOSH looked at that. They determined that there was research on certain methods that they think could provide sufficient decontamination without really affecting the functionality of the respirator itself. And so they listed, I think, five types of decontamination. That would be hydrogen peroxide or vaporous hydrogen peroxide, UV irradiation from ultraviolet light, moist heat from an oven, microwave generated steam, and liquid hydrogen peroxide. And those five things, they said, look, if that's all you got, if that's your only option, we're going to kind of, again, use our enforcement discretion and allow for that, even though it doesn't really comply with the standard. Now, in that same document, they listed 7 or 8 other types of decontamination that they said, these are not something that you should be using unless you can find further evidence and data that suggests that they are going to be safe and effective. And it's ultimately up to the employer to show that they are safe and effective, and you may want to go back to the manufacturer as well to get some information on how they would recommend that you decon using those types of methods. But again, that is something that is not in compliance with the standard. It it eliminates the NIOSH certification, but we are using enforcement discretion during this time. I think one of the last kind of enforcement discretion documents is on just general good faith efforts during the pandemic, where we were talking about, we understand that during this time, employers are going to have a hard time meeting certain deadlines. And especially in terms of annual or kind of perennial type of trainings, audits, things like that. And so we said we will consider using enforcement discretion when there are good faith efforts that show that the employer is trying to get these things done but just hasn't been able to because of the pandemic. Those things include stuff like annual audiograms. For a while there, a lot of non-essential healthcare operations were closed down, and it wouldn't maybe make sense to send somebody into a clinic to get an audiogram if you have them in a hearing conservation program, or maybe not have the van come out and test everyone. Respirator fit testing, that's another one. We already kind of discussed that based on some of the other documents previously, but also medical evaluations. The entity that kind of oversees spirometry, they recommended that spirometry be postponed and not conducted during this pandemic, or at least for the time being. And so that affected the ability for employers to have certain medical evaluations conducted. Crane certifications didn't really make sense to have some of these classes and services available. HAZWOPER training, stuff like that, and even things regarding the process safety management standards. So there are a number of things that we are allowing employers to go beyond the deadline on in terms of training and annual evaluations. But again, good faith efforts. We got to, you should be ready to explain why it's taken that long or why it hasn't been conducted. And then record keeping and reporting. This one has been a little bit complicated. There have been 2 guidance documents on this. One of them took us all the way up to just a few days ago. I think it expired on like May 25th, I think, or May 20 something. But we are now into the second document. So I am going to not talk about the first document just because it no longer is in effect. The second document was released last week, became effective, I believe, on May 26th. So that would be yesterday. And so what it said is COVID-19 can be a recordable illness if a worker is infected as a result of performing their work-related duties. Now, these are going to be case by case. And for all cases, you have to have 3 things in order for it to be recordable. Okay, first off, you have to have and this is not just for COVID, for anything, you have to have an injury or an illness. That injury or illness has to get to a certain criteria level, a certain severity level, which would involve either medical treatment or days away from work or transfer or restriction of job duties, or obviously a fatality. So it has to get to a certain severity level, and then it has to be work-related. And the work-relatedness is the part that is going to be very difficult in COVID. And so what they said in these memos, and especially in this last one, is, for the healthcare industry, for correctional institutions, for emergency responders, those kinds of industries, we do generally expect them to conduct the normal type of evaluation. So for each COVID-19 case, they really need to examine that and see if it was work-related. And in healthcare, you're going to expect those things to be work-related because you've got all these patients coming in with COVID-19. Now, for other industries, we're saying something a little bit different. We are telling them that, they don't necessarily have to follow up with looking into medical records and things like that. But if you have a COVID-19, you should conduct kind of a general investigation where you ask the employee, about their exposure and where they feel they may have gotten it. Also look at your own work environment to determine, hey, was this person closely working with someone with COVID? Are there COVID cases within our job environment? Or maybe they were working with a client that somehow you found information that client had COVID-19. So there is somewhat of an investigation that needs to be conducted. But unless there is kind of obvious evidence that it is COVID, that it was contracted in the work environment, and there's no other explanation, then you don't necessarily have to record it. So it's case by case, and the investigation doesn't necessarily have to be that thorough when you just have, one case. You might have one case now, you get another case that pops up 5 weeks from now. You're going to do a little bit of investigation. I'd say just follow the guideline in that document to determine whether it's COVID related or not. Now, when there's obvious evidence, say like with the meat packing plants, at one point, that Smithfield plant in South Dakota, and this isn't OSHA information, but this is just, what I heard on the news. I think they had half of the cases in the state early on, when there were maybe 800 cases in the state and there were 400 in Smithfield. Obviously, that is a work-related, those are going to be work-related cases when they're working shoulder to shoulder and more than half the facility has COVID-19. But this is something that it's going to be kind of a case by case. You're welcome to call me and we can talk through it if you have that kind of issue. But it is something that we will be requiring employers to put down if it's a confirmed case. So again, it's a confirmed case and it's work related. That's going to be the toughest part. And it gets to that criteria of missing work or medical treatment, which I think it will be if it's a COVID case. So that is something that we probably get, I would say, the most questions on. And then lastly, we had a guidance document that came out just like the record keeping one. It came out in 2 phases. We had one that covered up to, I think, May 19th, and then it expired, and we have a new one that covers from that point on, and that is kind of our interim enforcement response plan. So it tells you what OSHA is doing during this time period and how we're going to be conducting responses to complaints, referrals, reports of severe illnesses, and it lays out, our plan. And it has changed a little bit from the original one to where we're going to be getting back to doing a few more on-site inspections than we were. We were largely doing a lot of what we call phone and fax or non-formal investigations, where if we got a report of an injury or illness, we were doing many of those through the phone and fax process, which is something that we have always done, but not so much. We do it when we have what we call non-formal complaints, where we get a complaint, but it's maybe not from an employee, and maybe the allegations or conditions that are alleged are not that severe, or it's not covered by one of our emphasis programs. We will call an employer and ask them, or tell them, hey, we've got this allegation. Please provide us with a response that shows us either this is not happening as it's been alleged, or it's being corrected. And if we can get that information from them and they can show us, document, demonstrate to us that it is not going to be an ongoing issue, then we will close out that investigation. If they can't show that to us, then we will conduct an on-site. So we've always done that for a kind of a smaller portion of the complaints and referrals and accidents that we get reported to us. But during the COVID-19 pandemic, we got a lot more complaints, and we wanted to make sure that our staff was safe, that we weren't putting other employees in any kind of risk. So we did back off on that a bit. We are starting to open up with a few more inspections than we were prior to the last couple months, but we're still looking at doing a lot of these by through phone and fax type investigations. Now, when we do an on-site investigation, it might look a little different than it has in the past. You might get an opening conference from a phone call from the car. You may not have as much on-site activity, We may do things like getting the list of employees and conducting interviews with them by phone. I don't know how many of you have been through an actual OSHA inspection before, but those are things that we typically, didn't do. We would do on-site interviews. We would do on-site opening conferences. So we're going to be trying to look for ways to reduce our contact with employers, and on big construction sites where sometimes we would have, we're doing an inspection of the whole site and we have a bunch of subs and the general contractor and maybe each company has a couple or three people that want to come along on the inspection. We might be trying to minimize that and get that number of people who are walking the site with us as low as possible, trying to emphasize social distancing, things like that. So that document has a lot of information in it on exactly how OSHA is going to be dealing with complaints and referrals and inspections during this period. And it really is going to be a little bit different than how it was. But as I said, we're really trying to focus on doing a lot of phone work at this time. All right, worker rights. It's important to understand that workers, still have the same rights and protections as they always did to raise safety and health concerns, or receive information and training on the job. And we've gotten quite a few complaints on COVID through our whistleblower section, in terms of employees that feel that they've been retaliated against because of some of the issues with COVID-19. Now, so some employees have actually called into the office and asked, well, hey, can I refuse to work? And so it's important that as an employer, you understand that, the things that we're going to be looking at in those cases are, on this slide here, as far as work refusal, our whistleblower investigators, if there's a work refusal issue, are going to be looking at these things. Did the employee have a reasonable apprehension of serious injury or death arising from hazardous condition at the workplace? Did they refuse in good faith to expose themselves to the hazardous condition? They have no reasonable alternative. Was there insufficient time due to the urgency of the situation to eliminate danger through normal resorts like enforcement channels? And where possible, did they try to seek from the employer the correction to that hazard and were unable to get that? So these things were already in place, for very serious issues. But it's just during this time, you may come across people who refuse to work. And so you want to keep those things in mind as far as, the employee's right to say, hey, I feel unsafe. I don't want to do that task. And then there's tons of OSHA guidance out there. We have lots of guidance documents on our website. I'm sure that you've already perused it. There's almost so much that it's hard to keep track of, but we keep putting out alerts. And so one of those is the COVID-19 guidance for the construction workforce. I would say you definitely want to have that handy and look at that, because if we get, a complaint, like let's say you had an outbreak, you had 2 or 3 employees on a work site that had COVID-19 and one of them complained, or one of the ones who didn't have it was worried and called OSHA. We will be looking at, what was recommended by OSHA, what was recommended by CDC, to see if you are following those. And if you're not, why are you not? Is it feasible to do those things? Why would you not do them if you can? So there's, as I said, lots of guidance documents. Always, I mentioned before, you want to keep in mind that hierarchy of controls. Try to eliminate exposures first. Use engineering controls, work practice controls. PPE is going to be a last resort, but obviously it is something that is needed during this time. all kinds of updates available. I put out a newsletter. I've been putting out a newsletter about every week during this. So if you don't get it, please send me an email and I'll put you on the list. But I pretty much have included every new document. So we were putting those newsletters out about every 3 or 4 days there for a while. And lastly, here's my information again. And at this point, I will just hit up for questions. It looks like there's maybe 10 things on the chat.
John, can you hear me?
Yeah.
Okay, yeah. So I got to tell you, you're very thorough. Can you do me a favor? Can you put your phone on mute real fast, or your call?
Yes.
Cool. Not a whole lot going on in the chat. We will provide for the entire audience some links and kind of an overview of today's conversation. I think, John, it's just you're very thorough. Do want to open it up to the group real quick. I know it's OSHA on the call, but let's get some of these let's get some of these questions answered that you may have, and we want to make sure that you get all the links, but you've got a great source and good communicator right here for OSHA. So please, if you have any questions, if you feel as if you want to unmute yourself to chime in, go ahead and do so now.
I have one question, Paul.
Go ahead, Steve.
John flashed his email address up there with blazing speed. There was no way it was up there long enough for me to write it down. Can we redo that?
Yeah, he could probably reshare that, but we're also, Steve, everyone, we're going to send out a communication with all the links and John's contact information as well. But yeah, if you need it now, for sure. But we're also going to be sending that out. And John, if it's possible, maybe we can get a copy of this presentation, or is this just off of your website?
Okay, so first off, can you see the shared screen? Did I put it back up there?
Yes.
Okay. As far as the presentation goes, so Paul and anyone else who emails me, I will send you it, but I will send it in 2 parts. First, I will send you the section on temporary labor, and that is one that, I just put a few slides together. The coronavirus slide deck itself, I can only send you PDF, and I have to send you the complete national office version because they do not want us kind of changing. Now they want to speak with kind of one voice, and so I will have to send you a slightly different version. It'll actually just be longer than what I went through today. But it'll have the same slides. They'll just be interspersed with some other slides. But I can send that as well. It just has to be PDF because we're not sending out the PowerPoint.
Awesome. Actually, I just got confirmation from Polly that she actually has the slides currently that you're referencing, and we can
Okay.
send those out.
Okay.
Yeah. Thank you, John. Yeah. No need to parcel it. We'll send out the official. Do we have any other questions out there? Let's take another look here at the chat here. Okay. Well, we're not showing anybody in the chat. John, you've always been such a great resource for us over at IECRM, and I cannot thank you enough for coming in and really doing what you do best, brother. And that's just breaking it down for all of us on what we need to be forward thinking about, and just making sure we're on the same page as far as what enforcement looks like and some of the questions that we have and getting those answers. So you've always been a great resource. We can't thank you enough again. Do you have any questions, John, about any of this?
I do not, but just like I said, if anybody wants to talk one-on-one about specific issues that they have, feel free to contact me.
Awesome. Awesome. Well, to the entire group, I want to thank you for joining. We do have our weekly Wednesday from 7:30 to 9 member forum. Today was on safety with OSHA, and next week you'll see information coming about what the main topic of next week's meeting will be in your email soon. So thank everybody. Have a great, safe day. We'll get out some information to you later on today or tomorrow morning on today's communications, and yeah, be safe out there. Thanks, everybody.
Thanks, Paul. Thanks, John.
Thank you.
And watching just all drop off here. Paulie, thank you so much for taking notes and everything like that. We really appreciate it.
No problem at all. I would say if you can get John to send that PDF, we could still attach that to send out to everyone.
Okay, that's cool. Okay, let me see if I can get that then.
Do you want to stop recording as well?
Fine.